welcome to this lesson on the USign tablets here at El Rio Community Health Center, as well as the social determinants of health and the assessment of daily living documents. The benefits to using these tablets in the clinics are that with our patients that are 12 plus, it will help to screen our patients for their smoking status. It will collect the PHQ-2 screening. If our patient answers positively to either of those two questions, it will go on and ask our patients the PHQ-9 as well as score them, in addition to adding an alert to the patient record, as well as collect their medical history for our patients that have not been seen in a year, as well as for our new patients. For our patients that are 18 plus, it'll go ahead and ask all of those questions in addition to asking the domestic violence or safety screening questions, as well as the SDOH questions, and I'll get into those a little bit later. And for our patients that are 65 plus, it'll ask all of those questions in addition to the fall risk screening, as well as the assessment of daily living questions. So getting into the SDOH or the social determinants of health question. So what the definition is are the conditions in the environments in which people live, learn, work, play, worship, and the age that affect a wide range of health, functioning, and quality of life outcomes and risks. So why El Rio and why now? Well, this is the best way that we can serve our patients by breaking boundaries, honoring patients, and creating tomorrow. This is our mission statement and how we best serve our patients. Some of the drawbacks are that it can be time consuming, and some patients might feel embarrassed to answer some of the questions that are being asked of them. If we tell them the reasons behind why we're asking these questions, which is to basically identify any gaps in their care, it's usually okay with them. All right. Some of the benefits to this is that it cuts down on data entry for the medical assistants. It identifies the gaps in the care for them, and it allows the patients to answer these questions anonymously. So what the templates are. So we have the social determinants of health templates, or the SDOH template, as well as the ADL. So if you guys noticed recently on the intake tab, we recently added these sub-nav links here for you to make it a little bit easier for you guys to access them instead of adding a new template to your already busy templates. So we went ahead and added those for you. In addition to that, when you enter your screening summary for your patients that are 65 plus, we added this reminder that says complete ADL template. So if you guys remember, for your fall risk screening on your patients 65 up, on the fall risk screening panel, this will open up as well as your reminder to fill that out. So we've gone ahead and done that for you as well. All right, so using the USign tablet. So you'd begin by clicking the start button here, and I'm going to go ahead and pause here a second so we can go ahead and do that live with you. Okay, so I'm going to begin by clicking the start button here. On this, I'm going to go ahead and put in the patient medical record number. Each clinic has the option of changing this to have the patient's first two initials, last two initials, and date of birth, whatever's easiest for you. So I'm going to go ahead and identify that this is my patient's medical record number and click next. Next, I'm going to pick the forms, and so this is a test tablet that I'm using here, and so I actually have to identify the forms that I'm using. In the clinics, this is actually identified based on the patient's age and the last time they were here. So you guys wouldn't have to select the forms for them, okay? So I'm going to go ahead and click next here. All right, and I'm going to go ahead and just walk through this. So may we email you with appointment reminders? I'm going to go ahead and say yes. May we text you? Yes. How old is the patient? The reason this question is being asked is because they want to know whether or not to ask the SOGI question. So if the patient is ever minor and they're being asked the SOGI questions, it's because the parent didn't pay attention to this. So my patient is elderly, so they're 77, and the reason why I picked a patient that's this old is because I want the SDOH as well as the ADL, the Assessment of Daily Living questions to be asked. So my patient is 18 or older. All right, so I'm going to go ahead and say that my patient is still married. My patient is a veteran. Mickey served in the military. My patient speaks English very well. They do not require an interpreter. My preferred language is English. I am currently living in a home. There are 2 house members. My current monthly income is $1,200. I am the head of household. I am Hispanic. My current race is white. My gender identity is male. I identify as straight. I would like to be referred to as he. My sex assigned at birth was male, and my preferred name is Mickey. So this will come out on the nickname field. I'm going to click next, and here are my rights and responsibilities. And I'm just putting check marks in here, and I click next. And right here it's asking me to confirm my initials. So this would be on a form where I would normally kind of scribble in my initials. So I'm going to go ahead and click next. And what this did was it basically filled out my registration form. So if you see here, it basically took all that information and filled it out on the form for me. So you can see all of this information got filled out on here. Okay, here are the initials. If you see them right over here, those are the initials that I just entered in here. Okay, and I'm basically going all the way through. I also have the option of using this just to get all the way to the bottom, so I can skip through that. I'm going to go ahead and click next, and then I'm going to just use my finger just to get through this and click accept. And I just signed my document, and this gets saved into the categories portion of the EHR record. Okay, so that was just saved. And again, unfortunately, it is asking me the age of the patient. And now it's going to start asking me some of the SDOH forms. Okay, so it wants to know how often I exercise. So Mickey exercises, he does mousercise. Remember that, I'm showing my age here. So at least 3 to 4 times a week. Mickey graduated from high school. Let's see. I'm going to fill out a couple things here on the medical history. So, do you have a family, mother, father, sister, brother with history of illness or condition? So I'm going to say yes, and I'm going to say mother. And mother is deceased, unfortunately. She got caught by the trap. But I'm going to say that mother had diabetes and arthritis, and I'm going to click next. She also had high cholesterol, and I'll say next. I'm going to skip this on the other illnesses and go on to father, and I'm going to say father also had illnesses. He is also deceased, and I'm going to go ahead and give father cardiovascular disease and just click next. He also had elevated cholesterol. Click next and next. I'm going to skip no on the brother and sister. Same thing for grandparents here. Okay, and now it's asking, please select all conditions that you have been treated for. So if you see that right up here, it wants to know all of the conditions that Mickey is currently being treated for. So let's go ahead and say that Mickey is currently being treated for elevated lipids. All that cheese has got to go somewhere, right? So elevated lipids, I'm going to go ahead and click next here. And I'm going to go ahead and click next here. Has he had any surgeries? I will say yes. And I'm just going to go ahead and pick appendectomy and tonsillectomy. And I'll say next. Do you use tobacco? I'm going to say yes. And he's in his 70s, so I'll say he started in his 20s because he wanted to look distinguished. So for the last 50 years, and he was smoking a pipe. Okay. Does he have any medication allergies? I will say yes. And I'm going to pick codeine. I will say next. All right. Now, these are the assessment of daily living questions here. So what we want to identify here are whether or not the patient can do these items without any help, whether they need help or they can do this without any help, or they need a lot of help and cannot do this by themselves. So he can walk, he can get dressed, he can prepare meals and eat. He can also take his medication and bathe by himself. So I'm going to go ahead and click next here. He can use the bathroom and drive. He can shop for groceries. He can do his laundry. He needs a little bit of help getting in and out of bed or a chair, right? Because his knees are a little bit wobbly. And then I'm going to go ahead and click next. Okay. He has fallen though in the past 12 months and he fell twice. I'm going to say next. Did this fall result in an injury? So this is our fall risk screening, right, guys? Okay, so did this result in an injury? I'm going to say yes. What is your current level of pain? I'm going to go ahead and say 2. He's in his 70s. He's got to have a little bit of pain, right? Oh, and then this is our alcohol screening. So this is our expert. And so in our women in the past year, have you consumed 4 or more drinks in the year? Or for men in the past year, have you consumed 5 or more drinks? So I'm going to go ahead and say yes. And I'm going to say 2 to 4 times a month, 5 or 6, and I will say monthly. And then over the past 2 weeks, how often have you been bothered by? So here's our PHQ-2 screening, right? And I'm going to just say not at all. And I'll say not at all. And next. Okay. Blood type is actually removed from our production screening. So I'm going to go ahead and just say I don't know. Have you been discharged from the armed forces? And I'm going to say no. What is your housing situation? Again, this is the SDOH. I'm going to say I have housing. Am I worried about housing? No. The highest level of school. This is repetitive and this is not in our production database, only on my test tablet. So I'm going to go ahead and just repeat that. I am currently part-time because Mickey works over at Walmart greeting customers. And I'll say less than 20 hours a week at the one job. And he does not have insurance. He's uninsured. In the past year, have you or your family members been unable to get any of the following? So these are those gaps in care, guys. Remember I was talking about that? So I'm going to say he's had a little bit of a hard time with the utilities and medication. I'm going to go ahead and click next. Has lack of transportation kept you from getting to and from medical appointments, meetings, or getting things from your daily living? So I'm going to say no to this question and click next. How often do you see or talk to people that you care or feel close to? And I'm going to go ahead and say 1 to 2 times a week. And who are the people that you usually see or talk to at these times? So I'll go ahead and say friends because he still keeps in touch with Donald and Goofy. I will click next. Stress is when someone feels tense, nervous, anxious, or can't sleep at night because their mind is troubled. How stressed are you? I will say a little bit. In the past year, have you spent more than 2 nights in a row in jail, prison, detention center, or juvenile correction facility? Well, he's getting up there in years, so we're asking about the past year. He used to be wild back in his day, but not so much anymore. He is not a refugee. Do you feel safe and physically and emotionally safe where you currently live? So this is why our current domestic safety screening changed recently, guys. And so I'm going to say yes. History of incarceration? No. Are you afraid of your partner or ex-partner? I will say no and click next. All done. Finish. So I'm done. That took me probably about 15 minutes to complete, but as you can see, it might take someone that's elderly a little bit more time to get through those. That's essentially it. I would probably identify which patients you think you would benefit from the most in getting this done before you pick them. Somebody who might have their children with them that could get these done with sooner, that might be a little bit better. Or if you have time to ask some of these questions and input some of them yourself, that might be helpful as well. I'm going to go ahead and pull up NextGen so you can see what these look like on the other end. So just one second. All right, so here is my patient. So as you can see, I already have my medication allergy in here, and if I hover over my medication allergy and go in here, you can see that my codeine was entered. So I'm going to go ahead and close that there. You can see that my nickname, when I said I wanted to be referred to as Mickey, did come over, so that came over. I'm going to go ahead and click on the screening summary and just show you what this looks like. All right, so I can see that an entry was made in here. However, I cannot see what the actual response was, and this was kind of on purpose. So I'm going to go ahead and click on the tobacco use link. We still want you guys to know what the responses were, and that's why the information doesn't pull forward, because if there's a response, for instance, if the patient responds positively to the PHQ-2 screening, we want you guys to know what those responses are so that you can verbally report that to the provider. Okay, so here's my patient who is a smoker currently, and he is a pipe smoker. So you see the responses here. All you do is click save and close, and it comes down into the grid here. My PHQ-2 screening doesn't show up here, but when I open this up, I can see what the responses are. I click OK, it comes down. My SBIRT does show here, as well as the score. I'm going to come down here. Here's that reminder to complete my ADL template. My fall risk screening, I'm going to open that. Here is my falls in the past year, the number of falls, that it did result in an injury, and it does identify my patient as a fall risk. So probably something that you would want to talk to the provider about. I'm going to go ahead and click OK. And then here is my domestic screening, and it does say, do I feel physically and emotionally safe? I thought I said yes. Do not want my patient to... Oh, the wording's different here. Now I know how you guys feel, right? Okay, so here's the counseling and educational factors. This will change from visit to visit, so this is not something that we did for you. So something that you guys will still be doing at your visits. I'm going to go ahead and click save and close. I will click OK, and there we go. Okay, so there's that. I'm going to go ahead and open up my templates chooser. I'm going to go ahead and go to the intake template, and right up here under the specialty, I'm going to go ahead and just default to family practice, and I'll go to office visit here. I'm going to address my allergies as reviewed, and then I'm going to go ahead and open up my histories template just to show you everything that pulled over. Here's my tonsillectomy and appendectomy that I put in. What we didn't want to happen was we didn't want the patients to get hung up on the year. So for those of you guys who are, have these fantastic memories, a lot of us don't have these, memories where we remember the exact year. We didn't want patients fumbling through their purses or wallets to try and remember the exact year that these were done. So we just wanted them to input the information, and so the providers can go ahead and ask this information in the back. Okay, or you can ask if they remember in the back and then input that after the fact, but we didn't want them to get hung up on the tablets. Okay, and then here is the patient's family medical history. So the elevated lipids for dad, cardiovascular disease, mother with the elevated lipids, diabetes, arthritis, and the fact that they are deceased here. Okay, so all of this information got entered in here. As you can see, I believe this cuts down on quite a bit of your data entry. I think this is really helpful. I hope that this encourages you guys to use them. If you have any questions, as always, you can call the help desk. We are available at 309 4300. You can always call us. Let me go ahead and head back to the intake template so I can show you those sub-nav links. Here is our SDOH link. So I'm going to go ahead and click on this guy here. So here is this. So this template's a little bit funny, at least in my opinion it is. I'm going to go ahead and expand it just so that you can kind of take a peek at it. So here are some of the responses to it, but it doesn't always necessarily pull every single thing over, which drives me a little bit crazy. And so my OCD has a problem with it. And there's really not a whole lot you need to do in here because either the patient filled it out or they didn't, or they chose to skip it. So really all you need to do is click this generate document button. So that's all we have to do. So I'm going to click the generate document button. And I'm going to go ahead and do that. So I click generate document. It generates the document for them. And here it is. Here are all of their answers here. I'm going to go ahead and go back to the intake template, and then here is my ADL template, and here are all of the answers that my patient responded. I'm going to just click save so that it shows up over here in my footprints where my provider can see it. And let me just tell you a little bit about this template. So the providers are supposed to respond based on how the patient answered. So I can do this without any help. They're not really going to do a whole lot. I need a little bit of help. They might refer the patient to a CHA to see if they can help them. Like, for instance, this patient said they might need a little bit of help. The CHA might go ahead and talk to them and see what they can do to assist them. Or let's say they said they needed a little bit of help getting, shopping for groceries. The CHA might go ahead and help them in regard to that. Now, if the patient responded, I need a lot of help, then we might go ahead and refer them to behavioral health. Where our future is leading us is, depending on how the patient responds to these questions, whether it be in this category or this category, we are hoping that this will trigger a task to either one of those groups, either the CHA group or the behavioral health group. We're not quite there yet, but we're hoping to get there soon. So essentially your job as the nursing staff is basically just to open up the SDOH document and generate it, leave it there for the provider, open up the ADL template, leave it there for the provider. But if you identify anything that needs to be referred to the provider, such as domestic safety, a high PHQ, things like that, then please notify the provider so that they can address it with the patient. Okay, as always, if you have any questions, please call the help desk at 309 4300. We're here to help. Thank you, and thanks for listening. Have a good day.